Hello friends, hi. This is Dr. Tirth Gill. I want to talk to you today about some obstacles that come in the way of individuals being able to comply or take their medications. So the first obstacle begins in the office itself. When the prescriber talks to the patient, they should take time to explain the name of the medication, their brand name, generic name, because people sometimes get confused about that. Tell them, what dose and at what time it's supposed to be taken, and then provide written instructions also to go along with that. Ask them if they have any questions about their medication regimen. In the same vein, try to simplify the regimen to once a day or twice a day at the most for taking the medications. If you increase the dose of medications to more than once or twice a day, it becomes more difficult for them to comply. And the rates of non-compliance increase the more number of times the pill has to be taken during a daytime, or the medication has to be taken during the day. So that's number one, simplify the regimen. Explain what the medication is and when and how often it is to be taken. Also, tell them about the expected side effects, like let them know that a dry mouth is not a harmful side effect, but if they have problems with urinary retention, being able to go to void adequately for men and for women, then you need to probably reduce some of the medications. So let them know which side effect to be watchful or worried about, and which ones are expected and that they do not need to get nervous about. Then the cost factor, find out how much, have a sense of how much the medications will cost with or without insurance. There are some discount pharmacies like Walmart, Walgreens, CVS, Rite Aid, all of them, they have discount plans. So the patient can sign up with these discount plans and obtain some savings that way. Or the insurance will cover it, or if they're indigent, Medi-Cal will pick it up. But make sure that they have the resources and the means to purchase the medication that are being prescribed. Then talk to them about precautions that they should take if you prescribe a medication that may have orthostatic side effects. That means that the patient may get dizzy if they get up suddenly. Then explain that to them. Tell them to sit at the edge of the bed before they get up, so that their body has a chance to adjust and that they don't get dizzy due to the fall in blood pressure. That can occur with some medications, especially initially when they're starting out. Medications such as trazodone, Seroquel, low-potency antipsychotics like Thorazine, they all can cause orthostasis. So explain that to them so that they follow the precautions and don't have that side effect of dizziness upon suddenly standing. The other factor that that's an obstacle and goes into non-compliance is this sense of stigma with mental illness. And we have educated the public, but the stigma continues, and it has a lot to do with how family and friends also react to the idea that they have a mental illness. If they are diagnosed with a valid diagnosis and are having these symptoms serious enough to be put on medication, then the family and friends should support them and let them know that they are not any less because they suffer from an illness, just like you would not be any less if you had high blood pressure or diabetes. It would just be another illness that you have and you take medications for and then you treat. In the same way, the person should be educated and the family should also be educated that what they suffer from in way of mental illness is just as much a biological illness as any of the other medical illnesses that they may have. It's just as much an illness as heart disease, diabetes, kidney disease, or what have you. It's an illness that can be treated and made better with medications, and compliance is important. That is the thing that you want to get to them, that they're not less because the illness happens to be related to their mind. The mind is also an organ, and it can also have an illness. And it's very treatable. There's no one is better or worse because of having or not having it. It is one of those conditions that can afflict anyone. So respect it, and respect the person that has such an illness. And don't stigmatize to them. Don't feel stigmatized because they're your family member and have an illness. So that is important in terms of increasing compliance, that they feel normal about taking their medications. So education is key. We talked about simplifying regimen. Then there are depot or long-acting medication forms available also, like the antipsychotics, Risperdal, Abilify, Haldol, Prolixin, even Zyprexa. They all have long-acting forms, and if you should discuss the long-acting medication option should be discussed by the doctor and the patient, so that that can also be utilized. It becomes very convenient for the patient. They take their medication once a month by injection and take medications as needed for side effects, and pretty much otherwise can lead a normal life. And individuals with schizophrenia or psychotic disorders or other mental illnesses go on to achieve great things. They can have a full and successful career. So there's no need to limit your horizons because of the mental illness. You do have to take medication as prescribed, though, and keep up with your appointments. There are various applications on the internet applications, like phone, that you can download on your phone, that will help you with reminders. I'll put the names of these on a separate window. And there are also pharmacies that deliver medications to the home. Off the top of my head, some of these are, I think, Pillbox by Amazon, Walmart, Walgreens. All the major pharmacies do have a program where they can deliver medication to your home. So you have to ask about your pharmacist about it. So those are the main highlights. Of course, the more you can stabilize their health, mental health, physical health, the more they're going to be able to comply, make sure that they're sleeping well, provide PRNs for insomnia if they need it, do regular checkups for health, general health, and of course for the mental health. With all those measures, I think the obstacles to compliance can be overcome, and the person can do very well. Okay, thank you. Take care. Bye.